Do you sometimes feel weak and tired for no apparent reason? You might be suffering from a condition called anemia. Anemia occurs when a person lacks healthy red blood cells to carry oxygen around the body. This causes you to feel tired and weak, and in rare cases, it can even lead to death. Today, we'll learn about this condition and how best to treat it. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk on CNN Philippines. Let's welcome our guests for today. With us is Dr. Flor de Luna Zapata Messina. She is a hematologist from the University of Santo Tomas and Cardinal Santos Medical Center. Also with us is Dr. Ira Inductivo Yu. She's a gastroenterologist from the National Kidney and Transplant Institute as well as the Diliman Doctors Hospital. Now, according to the World Health Organization, anemia remains to be a major global public health problem, with about 2.3 billion people affected by this condition. In the Philippines, studies show that a large percentage of the population suffers from micronutrient deficiencies, the most common being iron deficiency anemia. Dr. Messina, how does anemia become a public health issue, especially in a country like the Philippines?
As there's a high incidence of anemia, and it should not be taken lightly because some mild symptoms like headache, dizziness, or weakness can be a cause of absenteeism at work. And so this affects the overall productivity of our workforce.
Are there areas in the country, Dr. Messina, that are usually affected by this condition?
The incidence actually is not based on the region, but more of age group. No? The risk factors or vulnerability depends on the age group.
There are several types of anemia, but the most common worldwide and in the Philippines are iron deficiency anemia or IDA and vitamin deficiency anemia. Dr. Messina, still, can you tell us more about these two common types of anemia?
Basically, there are three types of anemia when it is based on the cause. The most common is nutritional anemia. These are the iron deficiency, vitamin B12, and folic acid deficiency. The second would be the problems in production or bone marrow disorders. And the third is destruction of red blood cells, or what we call hemolytic anemia. But the two are less common.
Now, let's discuss the symptoms ng anemia. Dr. Ira, what signs should people look out for about this condition?
The level of the anemia would dictate the severity of the symptoms. So if you're just having very mild decrease in hemoglobin, people might just not, in fact, notice it. Or the manifestation would just be easy fatigability. Baka dati nakaka-jogging ng 15 minutes. This patient now could not even tolerate 5 minutes of jogging. Some patients would also have some sort of hingal. Dati, they can probably walk from the first floor to the fifth floor without any difficulty, but now would take only 2 flights of stairs, and probably that's all that they can do. Severe anemia, though, especially if acute, probably secondary to an acute GI blood loss, can lead even to collapsing of the patients, or in some patients, they can even have myocardial infarction or even stroke.
The usual suspect in iron deficiency anemia is poor nutrition, but anyone can still experience anemia acutely, especially if they are experiencing bleeding or have had surgery. Dr. Ira, what are the typical causes ba ng anemia para ma-aware ang ating mga viewers?
It could be due to iron deficiency, which, by the way, is the most common cause. And iron deficiency could not only be due to nutritional deficiency, but it may also be due to GI blood loss. Anemia could be due to anemia of chronic disease. So these are people who are chronically debilitated. These are people with chronic kidney diseases, with malignancies. Anemia can also be due to bone marrow defects. I think this is best exemplified by your aplastic anemia and your leukemia and lymphoma. And anemia can also be drug-induced. There are several medications that can bring about anemia. Example would be chemotherapeutic drugs, your immunosuppressant azathioprine, and even some hepatitis C medications like ribavirin and interferon. So basically, the way to analyze anemia is to zero in what is the cause, and from there on, treat the patient accordingly.
Dr. Ira, what gastrointestinal disorders increase the risk for anemia as well as iron deficiency anemia in particular?
Anything that has the potential to bleed in the GI tract can lead to anemia because of blood loss. So you can have bleeding peptic ulcers as cause of your iron deficiency anemia. You can have colonic ulcers, colonic malignancy. You can even have your inflammatory bowel diseases like ulcerative colitis and Crohn's disease. Remember that blood loss doesn't always equate to obvious blood loss. There are some people who are bleeding mildly, not even prominent in terms of their stool color. This is what we call occult bleeding. So basically, any lesion that will cause either an obvious bleed or an occult bleed can lead also to iron deficiency anemia. For a lot of people also, they might forget that intestinal parasitism can also cause some degree of anemia. So this is particularly true for our children who just put anything in their mouth and accidentally would ingest some warm eggs there. So we have to be careful also with our kids.
When we come back, we'll discuss who are at risk of developing this condition and its complications to our health. Only here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk, where caring is our calling. Babies and the elderly are among the age demographics who are prone to anemia. Dr. Messina, why are these age groups more likely to have anemia?
The four vulnerable age groups are number one, the reproductive age group, especially females who are menstruating, because we lose iron in the body every month, no, during your menstruation. The question is, why are not all of the women who are menstruating anemic? This is because they are able to replace it adequately in their diet. Now, the second vulnerable group would be the children on their rapid growth, okay, because of an increased utilization of iron. Likewise with pregnant women, because you have two individuals utilizing iron, the baby and the mother. And fourth is the elderly population, because they are prone to malnutrition.
Gastroenterologists tend to receive patients with symptoms of anemia. Dr. Ira, how does having anemia complicate existing gastrointestinal diseases?
I think it's more of a person having an untreated, misdiagnosed, or undiagnosed GI tract disease, and there is an existing anemia there. So this GI tract, like for example, a colonic malignancy that is not properly diagnosed over the years, would lead to some degree of minimal blood loss. And that would worsen the anemia over the next few months or few years. So it's actually an undiagnosed GI tract disease that worsens or complicates the anemia.
Dr. Messina, how does anemia lead to other complications? And when is anemia the result of a pre-existing lung as well as heart condition?
The blood is circulating in the whole body. It affects each and every organ in the body. So from neurologic, from the brain, it can cause cognitive impairment. Cardiac and pulmonary are very closely related to the blood. And so anemia can worsen a pre-existing cardiovascular disease like MI and heart failure. And then other organs like renal failure. So they both can cause and can worsen each other. Generally, it will also affect the performance to work and physical exertion. So it may generally affect not only the organs, but also the quality of life of the patient.
Dr. Messina, what happens when a pregnant woman is anemic?
It can affect the baby, especially in the growing period. So that's the first trimester and second trimester. It can also affect the outcome on the third trimester. So anemia is associated with morbidity and mortality to both the mother and the baby.
What tests should one do to determine if a person does have anemia, Dr. Messina?
It's actually easy and inexpensive. The screening test would be the complete blood count. And then when the hemoglobin is below normal, so it depends on the gender. If males, the normal hemoglobin is about 130 grams per liter to 170 grams per liter. So if it's less than 130, then that's anemia. For female, it's less than 120 grams per liter. So as simple as that. And then the other tests like your reticulocyte count, peripheral blood smear, and iron studies would come after.
Can you tell us, Dr. Messina, what are the healthy hemoglobin values for adult men and women?
So the healthy hemoglobin values or normal values for men is 130 grams per liter to 170 grams per liter. And for females, it is 120 grams per liter to 140 grams per liter.
Now, Dr. Ira, with regards to anemia, is it possible that many patients do not see the symptoms early? Meaning the early signs of anemia are often overlooked. So it is only when the patient is in maybe advanced stages of anemia that they seek proper consult.
Yes, that's possible, especially if the anemia is already chronic. If people have been used to a little bit of lower hemoglobin, actually they don't feel something bad. It's as if the body already adapted to a lower hemoglobin level. So it depends on the chronicity of the symptoms. If the anemia happens very quickly, okay, then the patient would manifest with all of these manifestations immediately. But if the anemia is happening gradually on a chronic basis, it is possible that the patient can adopt, possible that the patient might not be symptomatic, not until the hemoglobin drops to very critical levels.
Coming up, we'll give you tips on how to prevent this condition. Only here on MedTalk Health Talk. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. So when it comes to managing anemia, what can we do? Dr. Ira, let's talk about that. Is having a healthy diet enough?
Healthy diet is definitely essential if you want to prevent anemia and treat anemia, because any nutritional deficiencies, specifically in the nutrients of iron and folic acid and vitamin B, can also exacerbate anemia. From a gastroenterologist point of view, there should be a regular test, specifically if you reach like 45 or 50 years old. We usually recommend, as part of a screening, an FOBT or an FIT to detect for possible colon malignancy, because they can also bring about anemia.
Let's talk about the foods that should be avoided again.
Some literatures have pointed out that if you are taking in iron-rich foods, there should not be any simultaneous intake of foods that are rich in calcium or calcium supplements for that matter, on the notion only that calcium can bind to some extent iron and hence indirectly decrease iron absorption.
Now, Dr. Messina, how should people diagnosed with anemia exercise when one of their more common symptoms is that they feel tired all the time?
For patients with severe anemia, that's a hemoglobin of less than 70 grams per liter, exercise or physical activity should be limited because they will feel the symptoms more with these activities. While the mild anemia, like a hemoglobin of at least 100, and if it's chronic, then they're actually used to that level already. There's no physical activity limitation.
What's the best way for them to recover from the symptoms that they feel?
For the nutritional deficiency anemia, it can be prevented and easily treated. So the way to treat it is to give adequate supplement with the diet, of course, and also vitamin supplements, vitamin and mineral supplements. And once they recover, when the hemoglobin is improving, then they can go back to their usual physical activity. We advise them to eat iron-rich foods, and these are red meat. There are also vegetables which are high in iron: spinach, broccoli, tomatoes, and asparagus. They contain also iron. While your vitamin B12 rich sources are meat, fish, and seafoods, your folate rich foods are green leafy vegetables. So these are the things that should be taken for patients with nutritional anemias. And then for the treatment, diet will not suffice. You need to supplement them with oral supplement.
Now, before we go, Dr. Ira, do you have any advice or tips for our viewers?
The lesson that we learned from this preceding discussion is really to go on a healthy diet, a diet that is rich in protein, in nutrients, specifically iron and some of the vitamins, vitamin B, vitamin C also because it helps in iron absorption, and also with folic acid.
And Dr. Messina, do you have any tips or advice for our viewers?
Anemia is actually preventable, especially the deficiency anemias. So please get your blood works and also take foods that are rich in iron, folate, and vitamin B12. So basically a balanced diet.
Thank you, hematologist Dr. Flor de Luna Zapata Messina and gastroenterologist Dr. Ira Inductiva Yu for being with us today and sharing your tips and expertise about anemia. I'm Dr. Freddy Gomez and thank you for watching MedTalk Health Talk. We'll see you again next time.